Welcome back, everyone. A short break there to set us up for the next session. And if, as you rejoin us, if you were chatting to others, doing a bit of networking, remember to switch off your camera and mic during the presentation of the speakers, although I suspect that happens automatically. I hope you gained much from the workshops, sharing experiences and learning. And to build on that, we're going to welcome someone with a particular expertise in volunteering and the voluntary and community sector, in demographic and ageing and knowledge exchange. It is Irene Hardle, who is the Professor of Public Policy at the Department of Social Services at Northumbria University. So a very warm welcome to you, Irene. Hello.
Good morning, and I'm speaking from Nottingham in England.
All right, okay, so that's where you are, but we know you have this long association through academia and, many publications to your belt, 8 books and something over 100 other publications. So it is wonderful to have you with our conference at our conference today. So I'll hand over to you, Irene, for your presentation, and then you will introduce us to the speakers on the panel. So I'll hand over to you now, Irene, and we look forward to what it is you're contributing today. Thank you so much.
Yeah. Thank you, Helen. Everybody. And this morning I'm going to share with you a project that I'm involved with, along with teams across the whole 4 nations of the United Kingdom. And our project is entitled Mobilizing Voluntary Action. And we've been looking at researching voluntary action during the pandemic. Could I have the next slide, please? So our project is comprising teams of sector experts and academics from across the 4 nations of the United Kingdom. And each team is working within each jurisdiction. We also have a UK coordinating team. And we've received funding from the UK Economic and Social Research Council as part of the UK COVID Call. Now, the COVID Call is part of a block grant that came from the UK government at the beginning of the pandemic back in 2020. And the block grant was given to an organisation, United Kingdom Research and Innovation. And the Social Science Research Council of UKRI received funding to support projects that were going to look at the economic and social aspects of the pandemic. And I'm delighted to say that this morning our case officer from ESRC is present at our conference. Our project began in October 2020 and we're due to finish in January 2022. We actually had a proposal for funding during the first lockdown in June 2020. And I think you'll all agree with me, it seems an absolute lifetime ago. And little did we think when we submitted the proposal, quite how uncertain life would be as we approach Christmas 2021. As you can see from this slide, we have our project aims to explore the policy and organisational responses to coordinating and managing volunteers during the pandemic. And we're exploring a series of questions, such as, did the policy responses differ in the 4 nations, and how effective were they? Who has volunteered, and how do we sustain engagement beyond the pandemic? And can we gather and share examples of good practice to improve the volunteering experience in the future? Next slide, please. Our academics and sector experts have been working collaboratively to co-produce knowledge and have employed a series of mixed methods. So within each jurisdiction, there's been a survey of volunteer involving organisations, workshops have been held, and a series of interviews undertaken. So diverse evidence has been gathered over a sustained period of time. We've also been undertaking work at the UK level. This has been an analysis of policy documents and undertaking a thematic analysis of published research from each jurisdiction on the impact of the pandemic. We've also undertaken at UK level an analysis of managed data for recruiting volunteers. We've also produced theme podcasts and think pieces, and we have a range of resources on our project website. Next slide, please. Now, what are the outcomes of our project? Well, through working together, we've been learning from each other in each jurisdiction, and we've been sharing knowledge and experiences. And our aim is to help guide the UK volunteer effort to continue to respond to the pandemic, to support recovery and prepare for future crises. So learning for the future. And we're hoping to make a real impact to improve and enable volunteering efforts in the future in each context in which we live and work. I'm now going to say a little bit about policy analysis that's been undertaken. So could I have the next slide, please? So on our project website, we have a working paper 4 that has been written by our colleague, Professor Ewan Speed from the University of Essex. And as we all know, a number of policy fields are non-reserved, and this includes volunteering and the voluntary sector. And there was divergence in policy making and the policy focus across our 4 nations before the pandemic. And what Ewan has undertaken, working with our 4 national teams, has chosen a period from the first lockdown, March 23rd, 2020, and until March 22nd, 2021. We chose that date because it was the beginning of some easing of restrictions accompanied with the vaccine rollout. And what was gathered was the policy documents relevant to volunteering for each nation for that calendar year, which is seeing the ebb and flow of policies restricting our everyday lives and how we can practice volunteering. And the analysis that Ewan undertook has displayed the fact that the policy responses to the pandemic have actually exacerbated policy divergence that was already evident before the pandemic. This is especially between England and our other UK nations, highlighting English exceptionalism. In Wales and Scotland, partnership working and collaboration characterised policy responses to the pandemic, especially around processes of community involvement and engagement across a range of social issues, which has been a vital part of the response to the COVID-19 pandemic in Scotland and Wales. And this was also in Northern Ireland, but to a lesser extent than in Wales and Scotland. In England, in contrast, there's been a pragmatic focus on delegating to voluntary action as a subsidiary to complement the public health responses. So, for example, with the vaccine rollout. So very different responses, especially between England and our other 3 nations. Can I have the next slide, please? So that's been a very brief overview to the project. And I'm going to be joined now in the remaining part of the session by members of the project. So we're going to hear about UK work by Professor Aleister Rutherford from Stirling University, a fellow. And then we're going to go around each nation. So Matthew Linning from Volunteer Scotland will give us an overview of the findings of the project in Scotland. Then we're going to hear from Wales and another geographer, my colleague, Dr. Rhys Stafford-Jones from the University of Aberystwyth. And then we're going to hear from the England story from Catherine Goodall from NCVO. And then we'll end our journey back in Northern Ireland with a very familiar name you all know, Denise Haywood from Volunteer Now. So without further ado, I'm going to hand over, and then I will formally introduce Aleister Rutherford. Our first speaker is Professor Aleister Rutherford, who is a fellow geographer, but is Professor of Social Statistics in the Faculty of Social Sciences at the University of Stirling. So over to Aleister.
Thank you very much. So yes, I'm calling from Stirling in Scotland, and I'm going to talk about one aspect of the project, specifically our analysis of data from 2 UK volunteering matching services. So we've considered a range of evidence in the project of all sorts, but one of the challenges is trying to get a sort of real-time picture of what was happening to volunteering. We can get good survey information that gives us a lot of detail at points in time, but the advantage of using some data from these volunteer matching apps is that we've got that more continuous picture over time, and we can see who is registering to volunteer when. So I'm going to describe just a little bit of that very briefly for you in the 5 minutes through sharing 3 graphs from the analysis. So first of all, we want to look at the patterns of volunteer registrations across the 4 nations, and I'm going to show this graph here, which on the vertical axis is going to show you the number of volunteers registering compared to normal, and on the horizontal axis, time, and we split that up into different pandemic phases. We're going to show four nations of the UK color-coded like so. So at the start of the pandemic, we can see that first phase, which is pre-pandemic in early 2020, and then we see this really big spike in volunteers registering through matching app services, really as soon as lockdown came into effect at the end of March. And you can see particularly for Wales and for Northern Ireland, we're talking something like 50, 60, 70 times as many individuals registering with these volunteering app services as would have been the norm pre-COVID, but also big jumps in England and Scotland. So huge numbers of people immediately responding. We see that drop off again through into the summer easing. There is a smaller but still significant jump in the winter lockdowns around the end of 2020, beginning of 2021, again, where there's another surge of people coming forward and registering. So this really dramatic response to crisis in the number of people coming forward across all 4 nations. One of the issues, though, is how feasible it was to match people to opportunities, whether it was possible to run volunteering opportunities given the restrictions. So one of the things that we can do with the data is look at whether people who registered went on to record activity within the app. So this is the same idea here. We've got time along the horizontal axis, but now on the vertical axis, we've got the proportion of volunteers registering who then went on to record activity. And we can see that actually in the first lockdown, compared to the norm, that was much lower. So although we had this big surge in people, and many of them were matched, actually a lot of people weren't, that's due to the opportunities that are available and the difficulty in within the restrictions that were there in the lockdown, actually having people undertake volunteering. So although there was that big response, it was really difficult to actually match people to activities. In contrast, when we look at the peak from the winter lockdown, we see a huge number of people being matched there. We've got more than 50% of the volunteers registering in that second smaller spike actually being matched to opportunities and becoming active. So although that second spike was smaller, it was much more effective in actually being able to mobilize people. By that point, the restrictions were slightly eased. It was easier to see how volunteering could be delivered, how the opportunities might work, and organizations were more organized to have the precautions in place so that people were able to volunteer. So that gives us that kind of picture of that first response, and then how that was turned into volunteering activity. We also looked at a range of characteristics of volunteers and how that changed. And in my third and final graph, I'm just going to pick out one of those, and that's people who are volunteering that reported having a disability of some sort. So here, time again on the horizontal axis, but now we've got the proportion of volunteers registering who reported having a disability on the vertical axis, and we can see how that changes over time through the pandemic. So that portion is quite low, and in the first lockdown we can see it drop, and that's what we might expect, particularly for people who are concerned about higher risks of COVID, or perhaps who are on shielding lists in nations. Will have experienced greater restrictions or been more cautious. So we see quite a drop there in the response and the number of people volunteering with disabilities, and we see that again in the winter lockdown. Again, when there's that kind of increased risk and increased restrictions, that was a barrier to being able to volunteer in those two lockdowns. What's interesting here, though, is the kind of end of the period, and we see this across a number of characteristics where people have been able to come back to volunteering as things eased through the summer of 2021, and then as restrictions were opened up. But for volunteers with disabilities, as things opened up towards the end of the summer of 2021, we actually see that participation start to drop off. And I think it's important to bear in mind that as restrictions might be eased, that changes the risk profile a little bit. COVID is very much still here, and that so although opening up can make it easier for some people to volunteer and offer some opportunities, it does also have the risk of marginalizing other groups for whom that risk perhaps is still very real. And that's certainly concerning that towards the end of that time period we see that dropping off, and that effect is almost as big as the negative effect of the lockdowns on participation of people with disabilities. So that was three quick graphs, some reflections. We're surprised at how similar the volunteer response was across the policy nations, despite the sort of policy differences that you've heard about briefly. But a huge surge in people wanting to respond to crisis by volunteering that's played out in the data. Despite that challenge in matching people to opportunities, excuse me, first of all, that didn't deter people volunteering in later lockdowns when there was greater risk again, and then we were much more successful in matching volunteers to opportunities and mobilizing that voluntary action. For many characteristics, volunteer registrations through these sorts of apps have started to return to normal. We see that's smoothing out, but there are some groups and some characteristics where there is a concern that people might be left behind. And that's something we certainly need to think about how we deliver volunteering in this sort of later stages of COVID, where there are still groups facing risks, and that can be a barrier that the opening up doesn't necessarily apply to everybody. There's a lot more analysis in the briefing paper that's available online if you're interested to dig down into more of what we've done, and I look forward to the questions and discussion later. Thank you.
Thank you, Aleister. So as Aleister said, these plans were used before the pandemic, but they've become really visible during the pandemic, and we gained access to anonymised from two organisations for matching supply and demand of volunteers. Really interesting how the patterns across our four nations are similar. Said, there's much more detail on our in his working paper that's on our project website, where he explores in details the impact on age, gender, disability, etc. So I'm going to hand over now to our next speaker, and we're staying in Scotland, and I'm going to hand over now to Matthew Linning, who's Strategic Performance Manager of Volunteer Scotland.
I would like to focus on the lessons learned from COVID-19 in Scotland. That's both the opportunities and the challenges, and specifically those with the greatest legacy potential. First opportunity is the engagement of new volunteers and returners. 55% of those volunteering in Scotland during the first lockdown were new or lapsed volunteers, equivalent to 8 million adults in Scotland, which is a huge upsurge for us in volunteering in Scotland and interest in it. Secondly, the Scottish Government survey in May 2021 also highlighted the importance of volunteer recruitment. The opportunity for volunteer involving organisations, or VIOs, is not just to engage their former volunteers, but capitalise on the interest of those new to volunteering. Interestingly, for both formal volunteering and mutual aid, the highest adult volunteering participation rates were from our young people, those aged 16 to 24, which represents a key opportunity to be capitalised upon. Regarding societal needs, we all know that mental health and social isolation and loneliness have been the biggest challenges across a whole panoply of challenges in Scotland throughout the pandemic. Indeed, the worrying finding is that COVID-19 has significantly exacerbated these pre-existing challenges, but we know that formal volunteering has a key role in helping to address them. However, we also need to support address their own challenges, which includes the volunteers or availability of volunteers, volunteers' lack of digital skills, the challenge of making volunteering inclusive, volunteers' fatigue and burnout and other well-being issues, and a lack of staff support and equipment. This will require creative approaches to funding, additional volunteer management resources for VIOs, training support, and the optimization of digital engagement. Now, regarding the latter, 56% of VIOs have moved some or all of their activities online in Scotland, and it'll be essential to capitalise on the benefits that have been derived. However, a word of caution, the switch to digital was no universal panacea due to many volunteers lacking the required digital skills, the exclusion of beneficiary groups such as older adults, disabled people, and those excluded due to the cost or lack of equipment, and the basic fact that many services are not suited to online delivery full stop. It remains that face-to-face engagement is critical for so many services. Now, turning to community engagement, what has been remarkable about the pandemic has been people's willingness to contribute through both mutual aid and informal volunteering, not just formal volunteering. The positive community impacts include bringing people together, developing new connections and better relationships, supporting one another, and frankly, just kindness. However, and it's a big however, the tricky challenge going forward and what we're grappling with in Scotland is how best to foster and embed this new spirit of community engagement. Indeed, is it possible to do that? I now want to turn to the issue of infrastructure organisations and their role during the pandemic. And a key finding in Scotland of the Scottish research has been the importance of effective local support and coordination. In particular, Scotland's network of 32 local volunteer centres has played a pivotal role in the COVID response, undertaking a lot of the heavy lifting in partnership with a range of organisations such as local authorities, amongst others. In short, the crisis forced organisations to work together and at pace. The consequence was a step change in the extent and effectiveness of partnership working at a local level. It really is a sea change, and it will be essential to build on this legacy post-pandemic. Finally, Scotland benefits from having the third sector unit in the Scottish Government, which has a specific responsibility for volunteering. It was this the Volunteering for All National Outcomes Framework for our country, which was published back in April 2019. It provides a broad strategic framework which is currently being developed into a 10-year action plan for volunteering, and for which the outputs of this MVA study is ideally placed to support. Thank you very much.
Thank you, Matthew. I think some of the findings that Matthew shared with us will resonate in other jurisdictions. He's talked about engaging new volunteers. Now, heartening it is to hear about the the surge in the number of young volunteers, time and resources. Secondly, the movement online. It's both a blessing, we're all able to meet today by being online, but it also brings with it challenges for digitally excluded citizens. Other challenges: staff burnout, mental health, social isolation, but great positives happening at community level, with the growth in expressions of kindness through mutual aid and informal volunteering. And looking enviously from England at some of the infrastructure and partnership working stories that you shared with us, Matthew, the importance of partnership working at the local level through infrastructure organisations, and the strong strategy that comes from Scottish Government, and the fact that Volunteer Scotland works so closely in partnership with Scottish Government to give a clear direction to ensure that volunteering in Scotland, every volunteer is matched to the right opportunity in a strategic way. Now we're going to move now to another Celtic nation, and we're going to move now to the University of Aberystwyth, and my colleague and friend, Dr. Rhys Daffyd-Jones, a fellow geographer, who's going to tell us about events during the pandemic.
Yeah, thanks, Erin. Pnawn da, good afternoon from sunny and crisp Aberystwyth on the west coast of Wales. To talk about some of the data we've collected from a survey that was conducted earlier in 2021, in this sort of spring and early summer, and some interviews with stakeholders that were conducted by my colleagues in the project from WCVA, Sally Rees and James Lundy, in September. So what I want to focus on are some 5 themes, 5 tensions, if you like, emerging from the survey data and the interviews as well. So first of all, we have a tension between re-engaging returnees to volunteering and new volunteers. So as we've already heard during the pandemic, during the first lockdown and beyond, so an increase in people volunteering, an increase in grassroots and informal volunteering as well, sort of pop-up groups, if you like, around neighbourhoods, streets becoming very important to sort of meet particular needs. You see an increase in the diversity of people volunteering, so often around people of colour, younger people, men having more volunteer opportunities when not working and so forth. And that obviously declines as well when sort of other commitments for work restart as well. But what we often also see is questions for organisations around how to prioritise volunteering in the future, and a number mentioning that they'd like to prioritise existing volunteers, either people volunteering before recovery or people who've come to volunteer during recovery. And that possibly presents fewer opportunities for newer volunteers in the future. So if you've volunteered before the pandemic or during the pandemic, you're perhaps seen as more of a priority than somebody wishing to start in the future. And that has perhaps implications for younger people on volunteer schemes, such as the Duke of Edinburgh's Award, for example, or people volunteering as part of a college university course. And that, again, poses some questions around how people's relationship with volunteer might be impacted in the future, particularly younger people as well. So the second tension is around the flexibility of volunteering and the sustained delivery. And a lot of organisations spoke about wishing to provide more flexible forms of volunteering, more one-off forms that would allow people to be involved in a way that suited them and work around their other commitments. Discussions around moving towards more opportunities for people to volunteer. This is something which aligns with a number of issues being discussed in Welsh society at the moment. The Welsh Government have, after the election in May, have spoken about wishing to trial universal basic income in Wales. There's also been calls for trialling a 4-day week. So you have those broader structural reforms possibly enabling some more kinds of opportunities for volunteering, discussions about workplaces providing time off for volunteering. But what some organisations also spoke about was the need for sustaining particular deliveries. So, for example, if you're a food bank, you need to be able to be open at the set hours. You need to be able to deliver commit to the deliveries and meet those deliveries as well. So there's perhaps a tension there between flexible forms of volunteering, but also managing that in a way that enables the provisions to be sustained and commitments to be fulfilled. So the third tension is something which Irene and Matthew have spoken about more recently in the last few minutes, the relationship between technology and the need for training. So during the pandemic, there was more blended forms of volunteering. You have pop-up groups on WhatsApp or Facebook around sort of mutual aid emerging, and that sort of enables an immediate need to be met and met very, very quickly. Organizations moving to sort of training online or having meetings online, because it doesn't mean not having to travel so much and so forth. As we've heard, that sort of there's an element of digital exclusion, people not being able to afford the equipment or the broadband access. Certainly in Western Wales, quite notorious for broadband not spots, as we call them, and sort of limited speeds and access as well. And beyond that, there's also a need for trying to ensure appropriate training and safeguarding for volunteers. The pandemic, there's a feeling that things have been way through fairly quickly, but they need to sustain standards as well, and ensure that things are done carefully and done professionally as well. Fourthly, we have a sort of a tension between sort of, mutual aid and some of these emerging groups during the pandemic, and questions about duplication. And again, in the report we're drafting at the moment, which draws on some of the interview data, we have a picture of sort of a very agile response to the pandemic in many ways, being able to organise, self-organise, organise from the bottom up, meet immediate needs, and so forth, respond to particular demands as well, ensuring that they're met. But we had one of those stakeholders make some more strategic questions around duplication, and this isn't necessarily aimed at mutual aid groups or pop-up groups in themselves, but thinking more broadly in that questions about duplication in Wales. We have 22 local authorities, we have 22 county voluntary councils. Questions around, are there too many organisations doing similar things? Does that lead to competition rather than collaborating? So while on the one hand, there's value in these groups being able to meet specific needs and to respond quickly, and possibly as well being trusted sort of groups, there's perhaps questions around duplication or competition as well. And finally, we have a tension between the Welsh focus of many organisations and the challenges of information flowing. So again, many organisations spoke about the need to respond to particular Welsh contexts, particular issues and ways of doing things in Wales. Generally, a support for the way the Welsh Government have handled things, but also noting sort of a number of challenges in the flow of information. So first of all, organisations talk about the timing. Announcements often being made on Friday at lunchtime, and that puts a lot of pressure to get things sorted over the weekend by Monday and to try and put new plans in place. Perhaps there's some difficulty there. Difficulty as well in having the specific Welsh dimensions focused. Now, while the BBC and ITV News tended to emphasise the UK things only applied in England and what the Welsh situations were, there aren't really many, in fact, there aren't any Welsh editions papers, and you often have the UK government decisions being spoken about in general terms, not framed only as applying to England only. So questions around about information about what the situation is in Wales, what the regulations allow in Wales, not necessarily being fully sort of received or communicated in the most efficient way by the media. And finally, some complications around cross-border voluntary activities, particularly in the northeast of Wales, around Wrexham and Flintshire. So this is sort of organisations spoke about some of the challenges if they're a community transport group, for example, trying to organise transport for somebody to go to a hospital appointment in Liverpool. Some complications there of crossing the border and different sets of regulations being at work, what would they be allowed to do in the different jurisdictions, but also would they be allowed to cross the border to volunteer as well. So perhaps a specific issue relating to North Eastern Wales in particular, but one that does highlight sort of particular challenges for particularly difficult circumstances, such as providing support for people to attend hospital appointments in Shrewsbury and Liverpool in particular, but often very stressing situations as well. So I'll leave it there and hand over back to
Reese. So there was remarkable narratives in some of the issues in Wales, with those that Matthew articulated for Scotland. So, for example, re-engaging and also recruiting new volunteers. It's incredibly heartening to hear about the diversity of the volunteer pool by age and ethnicity changing, about organisations having to be flexible in the delivery of services, the challenge but also the opportunity that technology brings, and then the responsiveness and perhaps duplication of developments at the local level through mutual aid. Then we ended with a very important focus on the challenges of delivering policies in Wales, and the particular Anglo focus of our press and media in Great Britain, which is a clouded understanding of emergency planning that was happening at the level of Welsh Government, where policy making towards the emergency and to volunteering was being explained and trying to be implemented. And then a cross-border issue that was a surprise to us in England. The manifestation how some services are accessed in a different jurisdiction in England, where from residents in Wales, where there were two very different regulations shaping the delivery of those services. So that's a real challenge for the future. So now we're going to hear from England, and I'm going to hand over now to our colleague Catherine Goodall, who's Senior Influencing and Policy Advisor at the National Council for Voluntary Organisations in London. So over to Catherine.
Hi, Irene, thank you for having me. So I will share some slides. So I think a lot of what I'm going to talk about, we've already sort of covered or touched on in the different nations. I think that's really interesting. But I'll give a few reflections from England, and mostly today I'll focus on the policy aspects, because that's been the latest phase of the work in England. So we reviewed policy documentation, we did a survey, we carried out a range of in-depth interviews with some policymakers and some key stakeholders. And we've got a range of information for you today. So one of the things we wanted to talk about was just so we've seen that the English policy response, mainly at a national level, came up in sort of 5 key points. So we saw producing guidance to support volunteering during the pandemic. A lot of that was about pausing, adapting or changing volunteering to be safe. We saw the distribution of funding, both nationally, locally and through partnerships. We saw support for volunteering in testing and mass vaccination. We saw the development of the NHS Volunteer Responders Programme. So it was a huge programme where 750,000 people registered to volunteer within a few days. And we also saw the coordination of emergency partnerships and relationships, such as the Voluntary Community Sector Emergencies Partnership. And so I'll touch on what some of the reflections of these policy changes have been, and how effective people perceived these choices to be. In terms of the overall perception, so I think it's very important to note that they're very mixed. So in different areas, people had very different experiences of national policy. And I think that reflects the varied experiences during the pandemic. And also, I think it reflects the geographical perspectives that are driven by varied levels of kind of resources, of infrastructure, of levels of existing partnerships, but also where areas had already dealt with emergencies or challenges in their local area. Often that meant that the relationships, the structures, the resources were in place already, which helped them to respond to the challenges of COVID more easily. In terms of the overall perspectives, we saw some key aspects came up, and we've already heard about some of these already, and I'm sure we'll continue to touch on them, but communication was a key issue. And people were generally positive about the government's sort of call to action for volunteering at the national level, about that raising the profile. But again, as kind of others have touched on, the communication of public health guidance was perceived much more negatively. So it was perceived that that was last minute, that it was late, that it wasn't very relevant for voluntary organisations or volunteer infrastructure. And often organisations were having to catch up with that very last minute, and that was seen as a challenge. We also saw that collaboration and relationships was super important. And having pre-existing relationships was a key advantage. It enabled organisations to act quickly and to be effective. And as part of that, good communication, understanding and trust were really important. Unsurprisingly, funding was seen as a real enabler of that, supporting organisations to collaborate and build partnerships. And there's a big concern about a lack of funding going forwards, as many funding programmes were kind of ramped up on an emergency level, but may not continue. Partnerships such as the Voluntary Community Sector Emergencies Partnership were seen to support communication and coordination, both at that national but also that local level. And I think that's really important because we also heard a lot about national and local connection, communication, and that kind of duplication issue that Rhys was just talking about. We saw that kind of there's tension between national and local in England, and key issues were raised about a lack of understanding or a perceived lack of understanding of what volunteering involves and what volunteer management needs on a national level. The NHS Volunteer Responders Programme came up a lot in this research, and it was interesting because the perceptions of it were very mixed. And I think a lot of that relates to what was already in different areas already. So areas that already had strong volunteer infrastructure and strong responses found that programme perhaps duplicated or didn't connect well to those efforts. Whereas other areas that lacked that resource found the programme absolutely essential in supporting the NHS and supporting local communities. So I think that's an interesting point for us to pick up on, that different policy experiences are experienced differently across the country. Interestingly, in England, there's a perceived lack of leadership and strategic direction. So as Matthew was talking about in Scotland, England currently doesn't have as clear a direction for volunteering at a strategic level. And interestingly, that leadership wasn't just from government. There was a perceived lack of leadership in the voluntary sector that I think has some big lessons for us to learn. Participants were really interested and raised the question about what roles we should play, what role government should play, what role voluntary organisations and infrastructure should play, and what that should look like over the long term. And it was argued that more clarity is needed about leadership on volunteering issues in England, who makes those choices, and how the government can support wider policy making. So in terms of looking forwards, we've got some key lessons and considerations for the future, and I'll just touch on these very quickly. But as we've already talked about, the pandemic was seen to expose and amplify what was already there. So local areas that were better prepared could respond quicker. And I think that highlights a need to address inequalities and put investment, resources and coordination in place to prepare for emergencies and to respond to other challenges. As we talked about the role of collaboration and relationships, we think there's a need for better collaborative working on a kind of a local and a national level. And we saw a desire to build on and sustain relationships and partnerships like the Voluntary Community Sector's Emergency Partnership, and collaboration within the sector and between the sector and government. We also saw that there's a desire for that leadership, for that strategic direction for volunteering, and that includes more of a discussion about what role the state should play in England and what role voluntary infrastructure and organisations should play. The vision for volunteering, which is a big piece of work that NCVO and other organisations are involved in at the moment to build a strategic direction for volunteering that's owned by and developed by the voluntary sector, kept coming up in the research as a good opportunity for us to set that direction and to influence government, as do some other groups like Shaping the Future or the Together Coalition that I recommend kind of looking into. And kind of finally, we found out a lot about hearing a lot about having an opportunity to rethink what the volunteering ecosystem looks like. We've heard about many of the different changes to volunteering during COVID. So does this give us an opportunity to really think about volunteering, what would support it and what would keep it going? The importance of community empowerment and resilience within that. And that kept coming up as part of tying into the government's kind of levelling up agenda at the moment. How do we address inequality across the country to best support volunteering? And finally, just touching on that point others have mentioned about making volunteering more accessible and inclusive. What do we need to do to understand how to support everyone of every kind of background and need to volunteer if they want to? So that is just a whistle-stop tour of some of the key points from me. So I will stop sharing my screen.
Thank you, Catherine. And NCVO launched the report that accompanies the presentation just the other day. And so much more detail on that. Just mention a couple of points that Catherine has just articulated. The importance of collaboration. And this can be such things as building on pre-existing relationships or experiences of emergencies in the past. So, for example, if an area has been affected by flooding, etc. And the importance of geography, about the national response, and also things happening at the local level. And real pause for thought here on the importance of leadership from Westminster, but the important work that's happening in the sector at the moment through the Vision for Volunteering scheme that's taking place. And I'm sure Catherine can share more on the giving you the web link in the general chat box, which is a really important initiative taking place to get a meeting of minds within the sector in England to get a shared vision for the future of volunteering. Now, I'm now going to move back to Northern Ireland and a face you're very familiar with. I'm going to hand over now to Denise Hayward, a volunteer now, to tell us a little bit more about the project in Northern Ireland.
Thanks, Irene, and thanks so much for the opportunity to share this morning about what we've been learning in Northern Ireland. So in line with other nations that you've heard from already, we also undertook a survey. In our case, we surveyed organisations that were coordinating volunteering responses across Northern Ireland. We had a great response, and thank you if any of you are on the call this morning who filled in the form for us. We also conducted 5 interviews with policymakers at a local government, Northern Ireland government level, and also with some strategic organisations, infrastructure support organisations. And we're currently working through writing our report, and that will be available to you all in January. So watch this space. But I'm just going to give you a bit of a sneak peek of some of the findings from that report this morning, and just talk you through some of the descriptive stuff that we find about the response in Northern Ireland, and then some of the longer term implications that we're beginning to draw from some of that. So again, like other nations, we initially saw very high levels of people step forward to volunteer. And the really encouraging thing is that those were often new people. They were people who had never volunteered before. They were often younger, they were of working age, maybe benefiting from the furlough scheme and having extra time on their hands. So that was fantastic to see that upsurge of people really coming forward. I suppose the sort of slightly down news about that is that it hasn't been maintained, and you can see that through a number of studies that have happened. In Israel produced local findings of tracking volunteering over the last little while, and you can see that response has not been maintained. However, we also published a study with Queen's Belfast there in March, and it really showed that people who had responded in that first wave were still very open to volunteering, and more of those people who'd never volunteered before were still keen to volunteer going on in the future, which is really encouraging as well. One of the things that our survey showed is that it was much more difficult to maintain that high level of response in areas of high deprivation. And that seems to be linked to income and the need to actually be working in a paid capacity. And so that's something just to bear in mind, because it plays into that narrative about the equality aspects around volunteering and making sure that volunteering is something that everybody can do. Another descriptor really for us was that stepping back of traditional volunteers. That was really strong across all of the survey data that we collected. People really concerned about the number of volunteers who had previously taken part in volunteering very actively, who are no longer volunteering. One particularly Northern Irish thing, which I was really delighted to see was coming through the survey data, is the very positive cross-community response that we saw during the pandemic. People who never worked together before, organisations and groups and individuals who'd never worked together before, working together to support their community. And that's something that I was thrilled to see, and hoping that we can continue to build on that I suppose one of the other observational things was just the impact on volunteer involving services. I mean, we saw high levels of disruption across all areas. There wasn't a single kind of category of volunteering in our survey that showed that there had been no impact. So you can see that there was a massive shift for people. And even where groups were involved in the COVID response directly, there was still disruption to their own basic service delivery. What we have seen as well through the surveys is that some groups are better structured to come back from that, and some groups may not return. And the groups that people were expressing and are expressing specific concern around were some of the most informal groups, more like reading groups and those kind of maybe volunteer-led groups that have maybe struggled to manage with the digital services that they could provide and have not necessarily recovered. And those groups are fundamental to our community life. So it is something that we do need to be concerned about and need to look at how we can support to build back. Another aspect of Aleister's work actually was that we have not seen volunteer opportunity registrations return to pre-pandemic levels as late as August 2021. And that again is something that we need to look out for. Another observational thing about our study showed really importance of existing relationships. I think we've heard it from all 4 nations. That importance of infrastructure being in place before the pandemic hit, the importance of having those relationships in place, and the speed at which we were then able to build the structures and the things that we needed to actually be able to deliver through the pandemic, which was really down to having those relationships there and having that good solid infrastructure to start with was really strongly coming through, and the importance of clear information and interpreting government guidance for groups came through really strongly in the study that we have done. So when we look at future challenges then, I mean, there was a high degree of concern coming through our survey in particular. Organisations really worried about the future, difficulty in planning services due to the stop-start nature of our restrictions. We in Northern Ireland have just had another change to our working from home guidance just in the last week, and you can see the impact that that makes and the uncertainty that that creates, and the need for individual organisations to manage risk and interpret risk through the guidance changing has been a great pressure on boards and individual volunteers. That clear issue around the longer term falling away of older volunteers is a real challenge for many organisations. Those people are the backbone, or have been the backbone, of many services across Northern Ireland over many decades in some cases, and we will not replace those people straightforwardly, and we do need to consider that. So that's something that's come through very strongly in our survey. Again, optimism, people wanting to recruit new volunteers, but recognising that the people they recruit will not be the same as the people that they've lost, and the need to rebuild a team, and maybe for more people to come forward to replace some of the longer term and longer serving people that they've lost. Again, issues, concerns about safety, managing and designing safe roles was something that came through strongly in the survey, and the need for flexibility. How do we learn from the informal movements that we've seen over the last number of years? How do we manage that and make sure that that kind of formality that sometimes is needed doesn't feel too formal? And that was something that people were concerned about. And then finally, big concerns about having adequate resources, I think, as Catherine said, to deliver on this change that's needed, and needing training and support, particularly to move things across onto a digital environment, to get the best from digital, accepting that it has to be both. It's a marriage of both, and people need to get the best. Other things that came through in our study were about that coordination of spontaneous volunteers at the start. We had a massive surge of people, and not everyone was utilised to the best of their abilities, and we would like to think about that going forward. And then finally, our big question in Northern Ireland is the policy environment for volunteering. We've had a really strong volunteering strategy, which was reflected in the review that Ewan has done, but the strategy was published in 2012, and it's clear that given the current environment and the changes and the shifting that we've seen, that we need something for now, for fit for purpose. So as I say, report will be published in January. Looking forward to the opportunity to engage in a bit of discussion about this in the Q&A at the end. Thanks very much, Irene, for your support and for all the team helping us in doing this study for Northern Ireland. Thank you.
What Denise didn't say was the amazing response to the survey in Northern Ireland, the best response across the 4 nations. It was amazing. And like our other nations, the first lockdown saw a surge in volunteers, but also the challenges of disruption and maintaining relationships. And Denise articulated about concern, indeed anxiety for the future, how it is incredibly difficult to plan for uncertainty. There's been some very interesting information sharing in the chat box that I do urge people to look at. And
yes, that's a good suggestion, Irene, is that there's lots of things that people can connect to. Now, if it's all right with people, if we just run on to about 25 to 1 rather than wrap up at 12:30 as is on the programme, we might be able to get some of these questions in. So Irene, you'll know who best to ask from our panel of experts. It was wonderful to hear from them all. You know who to ask about this. So a question here, which is getting a lot of votes, says, has or will any research be done amongst people who wanted to volunteer but weren't giving anything to do? This is a rich seam of learning we don't seem to be pursuing at all. So quite a lot of people at the conference are tagging that, voting for it.
Yeah, I think that's a really important question. That it's one or two of our presenters talked about the problem of matching supply and demand. So suggest we go to Matthew first, because there's been a big debate in Scotland, and then perhaps to Catherine.
Okay, so
And for volunteering particularly during the first lockdown. But I think we need to temper engagement and appetite for a situation where people's interest in volunteering is conditioned by the personal environment they're in. And to be quite frank, people were furloughed, frankly bored and wanted to have engagement in society. That was the clear rationale that you've had so many folk coming forward. I think it's quite different. We did a big piece of research with Ipsos Mori, and it showed a huge increase in volunteering participation. 3 months, our volunteering participation rate went from 48% to 74%. That's across formal volunteering, informal volunteering, and mutual aid. There's a massive increase over 3 months, and and indeed the forecast figures were 59%. So there's recognition that people said, I won't be doing as much when once we get back into kind of steady state beyond the pandemic. But the reality is, and academic research will tell us this, there's a big problem of kind of optimism bias and being conditioned by the factors at the time influencing what you think you will do in the future. And I think we've got to it'll be very interesting to look at this data in 3 or 4 years' time as to where we're at. I'm not convinced there's turn in total engagement. I do hope that we can capture stuff at a community level, and indeed this informal volunteering and mutual aid effort, and try and encapsulate that at that level.
Catherine, do you want to pick up on that as suggested by Irene?
Actually, I think it's such a good question. I think it's absolutely vital that we carry on kind of reviewing what's worked well. I think Rob's shared a blog in the chat that would be really useful for people to read. And I think so from our research, we heard a lot about the NHS Volunteer Responders Programme, for example. And I know that the Royal Voluntary Service are doing their own evaluation of that programme to explore what worked and what didn't. I think there's an important point to note here as well about the kind of perception of how quickly we could be mobilised as volunteers if we signed up for something. I think we heard a lot about a perceived delay, which may not necessarily reflect a realistic expectation of how you could be mobilised and how quickly. And I think particularly when we saw 750,000 people registered for that programme in 4 days, that's such a huge administrative challenge. So I think there's a balance. I think there were delays in some areas and there were challenges with that programme in particular. But I think also being clear to people what they could expect as a volunteer when they register with something, how they could expect to be mobilised. But I also think there's one key point as well that's really important for us to explore about the volunteer experience. We know from our time well spent research and lots of other evidence out there how important it is to have a good experience as a volunteer. And I think it's really important that we consider what the impact has been for people who weren't able to give their time or weren't able to volunteer in the ways they wanted to, and hopefully try and address that as we move forward.
Yes, that's great. A lot of people will take from that. There's another question we've got time for. Is Irene, who would you ask about this? what are the key things policymakers can learn from the experiences of the past 2 years? Who do you suggest we turn to first?
Right. I think we'll Rhys, and then Denise, and then I think we hear from each nation. So Rhys first.
Okay, yeah, thanks. That's a great question. I guess my colleagues from the WCVA would potentially have slightly different views, but one thing I would that does come to mind is sort of the involvement of voluntary organisations and so forth in emergency planning. And what we see, or the evidence we have in Wales, is this is very patchy. So in February 2020, we had sort of quite severe floods in southern Wales, in the valleys in Cardiff. And in those, while this is a very different emergency to a public health emergency in COVID, you had a lot of connections being made. People were aware of the fora, or the people that they could speak to, so it was easier to signpost things as well. So the evidence suggests that it's fairly patchy from sort of areas which had floods in 2020, often had those relationships are sort of out of the blocks a bit quicker than other places. So whether that's something that could be taken, it's certainly the clear point that comes through from the interviews for me.
Yeah, actually, that came through in our interviews as well, specifically around the link between emergency planning and the community response, the voluntary and community sector response, and the fact that the two things weren't initially connected, because the emergency planning responses actually focused more on, the kind of blue light services, and even the third sector organisations, which were more blue light focused, and probably didn't connect into that wider part of the sector, which could have been sports clubs or community groups or churches or whatever. So there is a need, and I think that our new emergency response strategy for Northern Ireland, which has just been published over the last few months, does reference the importance of linking to the third sector. And I know that work is going on at the moment in relation to that. And I definitely think that's something that we've learned, that that the linkages weren't there strongly enough to start with. Although we do have, again, recommendations from a flooding report there a few years ago, which again have said that, but because our government hasn't been in place for a number of years, we were kind of behind the curve a wee bit with some of that. And then the other thing for us is obviously the volunteering strategy, because ours is quite out of date now. So that's us.
And then Catherine, to get two very contrasting stories now from England, Scotland, and then
Who would you like to call up first, Irene? There's Catherine coming now. That's
Okay,
lovely. Thank
there's
you,
one key
Catherine.
message.
And Matthew's
I
there too.
think they would be the first to admit as well that I think there was a political driver to respond to the NHS headlines of 750,000, and I think within about 10 days we had launched one in Scotland, and we generated just on our side with about 55,000 volunteers signing up. And basically the problem is that those were not fulfilled. I think it was probably as low as 10%. So the problem we've got there is actually you can actually have negative and perverse outcomes. We've got people that were really fired up to volunteer and then couldn't have that fulfilled. Key message here is I think it's improved connectivity between particularly what's in Scotland called the third sector interfaces or the volunteer centres, to basically to listen to their voice of the face and informing government policy in any future crisis.
Catherine?
I think, yeah, that's such a good question. And I think similarly, we saw a lot about planning and preparedness in advance and kind of learning from this pandemic and moving forwards. And I think we heard a lot about kind of understanding about what volunteering is, how volunteers are managed, how that differs across the country, and how that kind of local inequality plays out. And I do think we are really hopeful about the vision for volunteering in England, about us coming together as a sector to develop that strategic direction and hopefully working alongside government in some form of partnership to kind of implement that and work and kind of explore what the role of government should be, what the role of voluntary organisations should be in supporting that more broadly.
Wonderful. Thank you, Catherine. And thank you to Aleister and Matthew and Rhys. and Denise for contributing to that panel session. Irene, I'm sure you're very pleased with the thoughts and the analysis and the information that was passed on around all the nations.
It's been a collaborative venture, and we've all learned a lot from each other. So there's been real knowledge sharing. And also I've been absolutely delighted to read the comments in the chat box as well. So there are a wealth of information that we'll be recording as well.
Yes, I see that. There's lots there, and people can just dip into that quite easily. Irene, thank you very, very much for taking us through this part of the conference. Obviously, it's lunchtime, albeit 5 minutes late. If people want to network, like you did through the coffee break, you know how to do it. Just go to the table you'd like to join and double click and have your camera and mic in action. So you'll be able to just sort of have a nice relaxed lunch and catch up with other folk in the process. And we'll join back together again at 1:15. So thank you once again to everyone so far, and we'll see you in half an hour or so. Thanks now.